The leader of the official opposition had some strong words today about British Columbia's new policy on decriminalizing drugs. Yesterday, the province launched a 3-year pilot project allowing personal possession of small amounts of certain illicit drugs. But Pierre Poilievre says similar policies have contributed to drug crisis there.
Just need to look at the data. A 300% increase in drug overdose deaths in British Columbia since Trudeau took office 8 years ago. The Trudeau NDP approach is on open display in Vancouver. It is a complete disaster. It is hell on earth.
Okay, let's dig into those comments and bring in Benjamin Perrin. He is a law professor at UBC and former legal advisor to Conservative Prime Minister Stephen Harper. Welcome to the program. He's also the author of the book Overdose, Heartbreak and Hope in Canada's Opioid Crisis. Joins us now from Vancouver. Again, welcome to the program. As you heard Mr. Poilievre say there, he called it hell on earth in Vancouver and seems to be blaming partly this new policy that we're seeing from the federal government and the provincial government. What are your thoughts on that?
Well, this policy to decriminalize people who use drugs has been in effect for less than 24 hours. So it's a little absurd that he would blame the policy for what's happened over the last 6 years. That's kind of mind-boggling, to be honest. What we know is that since 2016, over 35,000 Canadians across the country, right? It's not just here in BC. In fact, most of those deaths were outside of BC, in provinces like neighboring Alberta, have died of illicit drug overdose deaths. So Mr. Poilievre's plan is to continue to criminalize people who use drugs. So all those people who died, all those loved ones and family members, he wants to continue to threaten them with jail. That's what it means to continue criminalization. He supports that. And we know that that's wrong. We know that that's a huge part of the problem, and that the stigma and the shame of substance use is what drives people to use alone, where they're much more likely to overdose and die.
You've worked in the Harper government, and this is, the same type of policy that we've really seen from the Conservatives is they're sticking to do not decriminalize these very illicit drugs.
Look, this is exactly right. This is a continuation of the war on drugs that Mr. Poilievre is supporting. It's discredited, it doesn't work, and in fact has precipitated the opioid crisis. He wants to try to crack down on the substances at the border. He wants to keep it criminal to use drugs. Like we've tried that. We've been there. We've done that. It doesn't work. That is why we see the deaths. And if we look at deaths increasing, deaths in Alberta also have increased over that period of time that he's talking about since 2016 as well. And so really, this is a national crisis, and it needs to be dealt with based on the evidence. And what the evidence shows we need is to, first of all, substitute the drugs that people are dying from using, these toxic, contaminated street drugs, which Mr. Poilievre continues to allow because he doesn't want to support safer supply. So the only alternative, if you have an addiction, is to go to a street dealer. The evidence is that if you provide someone with a regulated, safer supply, that keeps them alive, helps them stabilize, gets them out of criminal justice involvement, and increases their chances of getting into treatment. So that's one, safer supply. Second is decriminalize. We need to stop treating people who have an addiction as criminals. And thirdly, we need to provide much better rapid access to treatment and recovery. So that, combined with the measures like overdose prevention sites, are what all of the experts are saying we need to do now. And Mr. Poilievre, quite frankly, is opposed to even the Canadian Association of Chiefs of Police, who says that we should decriminalize simple possession.
There are some people out there who, in his constituency, I would assume, and others who maybe don't agree with this as well. He does say that he would increase funding for treatment and for recovery. Is that not enough?
Well, people have to be alive to get into recovery. So him and his party have also opposed safe use sites where people actually could just basically get medical assistance if they overdose. He's opposed those and the expansion of those. He wants to, on the one hand, says he wants to get people into treatment, but on the other hand, he wants to continue to threaten them with jail time. So which is it? If we continue to criminalize something, how hard is it for someone to put their hand up and say, you know what, I have an addiction, I have a substance use disorder to an illegal drug. And under his plan, we're going to say you're a criminal and you're threatened to go to jail. And in fact, these policies are deadly. This isn't just politics he's playing. This affects people's lives. The research shows you are 50 times more likely to die of a drug overdose if you're sent to jail and have a substance use disorder. So it is like a death sentence for people who have substance use disorder to send to prison. And he wants to continue to criminalize people who have substance use disorders.
Let me ask you this. A lot of people are probably sitting at home saying you worked for the Stephen Harper government, the Conservative government. How did you come to this approach? Because it's more on the Liberal side of the spectrum.
Well, I don't know about that. I would say there's also libertarians who support drug decriminalization. There's also, quite a few, there's quite a broad section now. But for me, I mean, I actually grew up in Calgary. I went to high school debate. I actually know Mr. Poilievre back in that time. We grew up in the Reform Party movement. I know the same rhetoric and ideology intimately well as he did. And I bought it too. I drank the Kool-Aid. But then I actually started to talk to people who have substance use disorders. I set aside that ideology that he is being led by, and I followed the evidence. I actually went and met and talked to people. I didn't just film videos with homeless people behind me like he's doing, but actually go and speak with them as part of my research and in my own personal life. And I got to find that most people who are using substances, this isn't a party drug. Fentanyl, which is killing most people during the opioid crisis, it's a pain relief medication. That's what it was created for. And people are using that to medicate very deep pain, childhood abuse with Indigenous people, the ongoing impacts of residential schools. And Mr. Poilievre, rather than provide compassion and support for those folks, says in one breath, yeah, we'll give you treatment, but we're also going to continue to treat you like a criminal. You can't have it both ways.
Politically, how do you think his message is currently playing to the electorate, not just in British Columbia, where we see a huge problem, but right across the country?
Well, I think we've got a real, knee-jerk reaction thing. We know that it wins votes to demonize people who use drugs. When we study stigma, and we look at, studies of this, who is the most demonized group in society? It's people who use drugs. So they're an easy target for cheap political points. And politicians, conservative politicians at the provincial level have also done this, where they've opposed life-saving interventions to help people. We need to call it out. It's wrong and it's immoral. I don't care if it's going to win them votes. It's killing people to oppose supervised consumption sites in provinces like Alberta, provinces like Manitoba and Ontario, where we have provincial conservative premiers who have either shut down, stymied, or cut funding for those life-saving programs. So we need to put our ideology aside. People's lives are at stake. Quite frankly, I don't care if people play politics with certain issues that don't really have a direct impact on people's real well-being. It's not great, but it's going to happen. When it comes to a public health emergency like the opioid crisis, Mr. Poilievre needs to sit down and listen. He needs to listen to family members of people who've overdosed and died. I don't even believe he's met yet with groups like Moms Stop the Harm. They support drug decriminalization. They support safer supply. So who is he listening to? Is he just trying to get elected, or is he actually trying to do the right thing and follow the evidence where it leads? And the fact is, the reason why people are homeless in cities throughout Canada is because we have skyrocketing housing costs and inflation, right? The average house of a home in Vancouver is, well over $1.5 million. We just heard a new report about somewhere between $2,000 and $4,000, depending on which study you hear, per month for a 2-bedroom place. So no wonder people are living in tents. So by the way, some of these people are families. These aren't just people who are using drugs in tents. There are children. There are children living out of cars and vans in my city. And I know that because we go and talk to folks. We don't just demonize them. And as neighbors, that's what we need to do. So, rather than when we see someone at the park sleeping in a tent, calling the police on them, why not cook them a bowl of, something warm to eat and go and see how they're doing and make sure they're okay? That is the kind of country I want to live in.
That's a really nice piece of advice. Benjamin Perrin, I want to thank you for digging into this issue. I really appreciate it.
Thank you.
UBC law professor Benjamin Perrin joining us from Vancouver.